A CT myelogram is an imaging procedure that provides a very detailed picture of the spinal cord, nerve roots, subarachnoid space, and spinal column using a combination of real-time X-ray called fluoroscopy and a CT scan. A CT myelogram is most commonly used to detect abnormalities affecting the spinal cord, the spinal canal, and the spinal nerve roots. A CT myelogram can show whether surgical treatment is indicated. It can help in planning surgery. In addition, it can be used to look for narrowing of the central cord where nerves run and/or pinching of the nerves. Before your exam, a technologist will review with you the informed consent document as well as any special preparations that may be required. Due to the type of procedure, you must have a driver with you. The informed consent document provides an overview of the procedure, desired benefits, possible risks, and your rights as a patient. If you are viewing this video on our website, you can access the informed consent document under Patient Information. Please be sure to discuss any questions or concerns you may have with the technologist or radiologist. The technologist and radiologist will work together to perform your CT myelogram. You will be positioned face down on the examination table. The radiologist will use the fluoroscope, which projects radiographic images in a movie-like sequence onto the monitor to visualize the spine and determine the best place to inject the contrast material. The skin will be marked, cleansed, and then numbed with a local anesthetic. A needle is advanced, under fluoroscopic guidance, until the tip is positioned where spinal fluid is located. The contrast material is then injected through the needle is removed, and the skin at the puncture site is again cleaned and a bandage applied. The radiologist slowly tilts the X-ray table, allowing the contrast material to surround the nerve roots or spinal cord. As the table is tilted, the radiologist monitors the flow of contrast, focusing on the area that correlates with the patient's symptoms. You will then be transferred to a stretcher and moved to the CT area. While on the stretcher, you will be asked to turn over to ensure the contrast continues to surround the spinal canal and nerve roots. You will then be positioned on your back in the CT scanner. The scan will take less than 5 minutes, during which you will be asked to lie still. The technologist or radiologist will monitor you post-injection before you leave. It is important that you plan to rest for the remainder of the day and do not go back to work. Adequate hydration after your exam is very important. Take plenty of fluids to help eliminate the contrast material from your body and to prevent a headache. Following your CT myelogram, you should refrain from strenuous physical activity and from bending over for 1 to 2 days. It's normal to have a headache following the procedure, but a severe headache for more than 24 hours, neck stiffness, or numbness in your legs should be reported to South Sound Radiology by calling 360-493-5539. You will also receive a copy of these instructions following the procedure. A radiologist, a physician specifically trained to supervise and interpret radiology examinations, will analyze the images and send a signed report to your referring physician, who will discuss the results with you. Because we are breaking the skin's barrier, there are minor risks, including but not limited to infection, bleeding, vessel injury, or allergic reactions to the medications used. To ensure you understand all potential risks, please review the procedure consent form found at southsoundradiology.com under Patient Forms and discuss your questions or concerns with the technologist. As the patient, you are our priority. If there is anything that we can do to make you more comfortable before or during the procedure, please let one of our staff members know. For more information regarding this procedure, or if you have questions or concerns, please call our office at 360-493-4600. You may also visit our website at www.southsoundradiology.com. Thank you for choosing South Sound Radiology.